Good afternoon, everybody. Hopefully everybody's doing well. We'll go through some data points, a couple updates, and take some questions. Obviously, yesterday was a very, very hard day. We had confirmed of our community passed away. It's tough with the nursing home updates. We don't know exactly when they passed away. Our assumption is that because we're getting updates on a daily basis that they're being updated daily, but we can't confirm that. Today we lost 2 more members of the community. We've now lost 334 members of the community, 20 members over the last 2 days, both men, one in their 80s, one in their 70s. Certainly our thoughts and prayers are with their families and everybody who's suffering and everybody who's lost loved ones during the pandemic, whether it's COVID related or not. We've all had to mourn differently, and I know how hard it's been. Looking at our positivity rate, our 7-day rolling average has dropped down to 6.6%, moving in the right direction. We continue to test and try to identify the virus. Looking at hospitalizations, now at 302, that's up 3 from yesterday. The ICU at 53, that's up 1 from yesterday. Our overall hospital numbers have essentially been flat. We've seen small rises in the COVID hospitalizations. The overall, it's been flat. ICUs have been flat, actually maybe down a little bit over the last 7 days. But certainly you can't get to that next tier of COVID activity and not see increases in the hospital numbers. And that's where this is when you look at all of this. New cases, we now have 15,952 cases. That's 378 new cases. When you look at this week's cases to last week's cases, we actually have seen a drop of between 20 and 25%. That's really good news. We haven't seen a drop in a week over week since the Halloween surge. It looks like tomorrow is going to be a little bit better than where we were last week too. So it looks like we're going in the right direction, but there's still a lot that can go wrong over the next few weeks. And even where we are, even though the cases are going in the right direction, the amount of work for us to continue to contain the virus at this level is still really tremendous. So we really need to keep going and then keep that momentum going into next week and going into the holidays. Hanukkah has started. We've been messaging gatherings. Christmas will be a real test for this community on getting together, and we'll see what happens probably late or mid-January will probably be the peak of that activity. But it looks like right now, at least, if we continue to do the right thing, we're going to be trending down going into that period, hopefully. We have had 8,049 female cases, 6,862 males, 2,491 under 19 years of age, 3,178 in their 20s, 3,327 in their 30s, 1,919 in their 40s, 2,241 in their 50s, 1,659 in their 60s, 969 in their 70s, 655 in their 80s, and 377 in their 90s. Symptomatic testing, Cayuga Medical Monday through Friday. Remember, with Cayuga Medical Monday through Friday at the F-Shed. Pre-register ongov.net/Cayuga Medical. That is Monday through Friday. We now have symptomatic testing on the weekends, but that is at Essentia Health. It's not at the regional market. So don't go to the regional market on Saturday if you want a COVID test. All you can get there is produce. So we don't want you, if you're symptomatic, going to the regional market and exposing yourself. So you got to go to Essentia Health on the weekend for that. Again, you got to pre-register ongov.net/Cayuga Medical. Nescentia Health is at 1050 West Genesee Street, and they will be doing testing from 8 to noon Saturday and Sunday. Asymptomatic testing, it's been going on every day here at the On Center. We'll continue to. Please pre-register for that. Our asymptomatic testing program going out in the communities has been very effective. Yesterday we uncovered a cluster of cases at an assisted living facility. A massive cluster, 27 individuals. Would not have happened if we weren't doing what we were doing. I'm very proud of our team for doing that. This allows us to get these residents that when they're asymptomatic preemptive health care so that they don't get sick and end up in the hospital. So we're going to continue this and do asymptomatic testing in these facilities. I think we're doing more testing today as well. The idea being that we need to find this virus where it is before it impacts everybody in a negative way. We've seen how vicious this virus is and how it impacts our seniors. And certainly really happy we found this cluster, and hopefully we'll get everybody healthy and keep them healthy at this facility. Looking at, we're not going to be open on Christmas Day. We'll do Christmas Eve testing. We've here at the On Center, we've expanded it. It's going to be from 9 to 1 though. We're going to do double the testing in 4 hours. But we won't be open Christmas Day. Next week, we have now set up various locations for community testing. Next week, the schools won't be open. So we're going to take that infrastructure and go into the community as well. December 21st, we'll be at East Syracuse Village Hall. Tuesday, December 22nd, we will be at the Town of Camillus Shove Park, Town of Cicero, Arrowhead Lodge in Brewerton, Skinny Atlas High School. And then on Wednesday, the 23rd, we're going to be at DeWitt Town Hall. We're going to be at the Fayetteville Senior Center, the North Syracuse Community Center, Onondaga Town Hall, and Skinny Atlas High School again. Again, you need to pre-register, 9 to 3 for those. And then on Christmas Eve, you can get a test here at the On Center. Normally we do about 400. I think we're going to do double that. We actually Christmas Eve was sold out this morning for pre-registration, so we actually opened it back up so more people could take advantage of that. But when you look at our strategy, we know we have to, when you're seeing a surge like this, it's critical that we identify the virus everywhere we can. We've increased our testing capacity, asymptomatic testing and symptomatic testing. We're doing thousands of tests. And through our program, we're getting results back faster than the national labs. So certainly we encourage people to try to register with us. The turn times are better than the national labs at this point due to the pressure throughout the country. But it's working. We're finding these pockets of folks that aren't showing symptoms. We're getting them isolated. Now with our surge strategy, moving more investigators into the health department, we're getting caught up and we're starting to get to that 24-hour turn time. We expect to be there very, very soon. And then we'll go into the contact tracing and make sure that if our partners at Bloomberg aren't in the time frame where they can get to it, we can then move those resources over there as well. So we'll isolate those after we identify it, we'll quarantine. And then the fourth part of the strategy now, which we're so happy about, is vaccinations. Today, we'll go over 1,000 people in our community that have received the vaccine. These are our frontline, at-risk health workers that will receive the first dose. Upstate will coordinate with other hospitals about getting them doses. Hopefully after the Moderna vaccine comes in. Right now we have some Pfizer. Moderna should be coming in soon. Hopefully at that point, our at-risk health workers at every hospital in the region, not just Onondaga County, but in Cayuga and Madison, and Oswego and Cortland will have received vaccinations. And then you get into the real, once everybody and your emergency, your EMS workers, your healthcare workers, then you get into phase two. And phase two is your essential workers, seniors. Those details are still being worked out. That's going to be a work in progress. But I'm happy to report our nursing homes. This is a separate contract than the state. This is a contract with the federal government partnered with pharmacies to partner directly with our congregate care facilities. Each facility partners with a different pharmacy. They set up a time for the pharmacy to come in and get the vaccination to the residents. Nursing homes in Onondaga County will begin receiving the vaccine on Monday. Some will be scattered throughout that. Certainly Monday we'll let you know how many people, but hundreds and hundreds of our most vulnerable people on Monday. That is really good news when you look at the folks that are getting very sick now. A lot of them live in these facilities. 30% of our hospitalizations are coming from these facilities. So this is really, really positive news here. When we look at going into next week, we're building up a little bit of momentum with our caseloads. What are some things that we can continue to do? We need to recognize, and I think we will, that we can't afford to have another surge like we did with Thanksgiving. And people need to really change their plans. If you had plans that involve quite a few people being together celebrating Hanukkah or Christmas, you need to change those plans. Not because I want to be the Grinch, but there's a high probability somebody has had exposure between 1 and 20 people right now. It's likely, whether they're asymptomatic, whether they're symptomatic. That's just the math. So we certainly need people to recognize this. Please stay within your own pods. There's even risk within your own pods. But by doing that, that is important. What can some of our corporate partners do in the week going up into Christmas? If you have employees that you don't need in your office, let them work from home. Let's de-densify some of the activity going into the holidays so that the potential transmission gets a little bit less going into it. Also, certainly, it's up to us to protect ourselves when we're out in public, physically distancing, certainly wearing a mask at this point. That should not, that should just be standard protocol. If we do these things, we'll continue to get this virus going in the right direction. And that will stabilize our hospitalizations. And then we won't see economic restrictions, and we'll get the positivity rates back where we need them to be so some of these businesses can open up again. If we don't do these things and we can't treat our sick in the hospital, nobody has an argument against restrictions. There is no argument. If you can't treat your sick, there's no argument. You have to be able to treat your sick in the hospital. And people are getting sick from something. If you don't believe in this process, you don't believe COVID's real, who are all these people that are getting sick? I know them, they're real, and why are they in the hospital then? So let's just stop the nonsense with that. Let's take this seriously going into the week, and we'll continue to get this curve going in the right direction so we keep our economy open and we continue to get through this as we have the vaccination ramping up at the same time. Really happy to report that we received a very generous offer from one of our local companies this week. They reached out to my office to volunteer several of their employees for the foreseeable future to assist the county with case investigations. We're going to take this company up on that offer. And so their employees are going to get trained with the Johns Hopkins course. They'll work from their own business and the company's resources, and they'll do case investigations doing this. This is a great corporate way to give back, and they recognize that for them to be successful as a business, we need to crush this virus. And so this helps the more we can beef up our investigation team, the better we'll be with this virus, because we can quickly isolate and quarantine. Really want to thank them, but we want to offer the same cry to our other corporate partners. If they want to participate, please reach out to our Economic Development Office, 315-435-3770. You can have your employees help us in this cause. They can get trained, and they can help with overflow cases for us in the region. But really want to thank this business didn't want any fanfare, or else I would tell everybody what their name is. I still may tell everybody their name moving forward. But to just give everybody, a synopsis on where I see things, today we have more recoveries, 471, than we had cases. Second day in a row. Case loads are going the right direction. There's a lot of risk in front of us with the holidays, a lot of risk. And with higher case loads, we get higher hospitalizations and higher deaths. So now's the time to rally on this front, when on the other front we're really boosting what will be, as the vaccines come into our communities, getting them to people. And we're really making significant progress with our isolations and our quarantines and our testing. Really, really great work there. So we're punching back with this virus right now, but we need everybody to punch with us. Questions? They told me, so I'll share it next time, Tim. But I'm going to tell the business that they have no choice anymore. The media is demanding. They know who they are. But they called up and they've offered early on their services in the pandemic. They reached back out when they heard us talking about our efforts related to investigations. They're offering up a dozen employees that will do. They're going to take the Johns Hopkins course. They're going to pay for them still on their dime. These employees will help our teams. Again, we're beefing this effort up so much that if the investigations are done locally, we were doing the contact tracing early on. The state system got up and running. They started getting very good. Now, just like everything else, they're getting behind with the increased loads, where if we feel that we can get better outcomes using our own people for contact tracing, we'll just do it all internally until the state gets caught back up again. So with corporate partners helping us with this, even if it's 2 or 3 cases a day per employee, many hands make light work, and allows us to really narrow in on different things that we're seeing.
What's the status of your effort to add the 175, and are you hiring to fill those? Yeah,
so I believe our status is we have brought on, I believe there's the 90 employees over, and their schedules have been worked out. In addition to that, we have reached out to some of our 103 employees, and many of the furloughed employees have been offered employment. I think there is for the furloughed employees, there's a word on some sort of negotiating that has to happen with the union, which I believe is happening, or already happened in the last day. And once that's done, that can happen. But outside of that effort, yes, we would bring on 103 employees to meet the needs related to investigations, testing, quarantining, and then potentially being part of the vaccination process once we know more what that's going to look like.
So the 90 those are current county workers that you moved over?
Correct.
Is there a privacy concern with a private company coming in and helping you with that contact?
You have to go through the same legal things that every employee has to. You have to sign HIPAA contracts, et cetera, et cetera. It's just like you have with your contact tracers and current investigators.
Yesterday, the governor named Upstate Hospital as the hub for a vaccination plan. Were you expecting that? Were you expecting not to be the lead on the vaccination plan? And I'm wondering how your plans will blend together as this moves on.
Yeah, that's really more of a chain of command with the actual product. You can't have 70 different entities holding on to the vaccine and then trying to manage that process, right? So you have a hub. He talked about a committee. We're on the committee. The health directors in each county will play a large role because you don't reinvent the wheel. Every year the federal government gives money to the state. The state gives it to our health department and says, do a vaccination plan for a pandemic. Well, we're in a pandemic and it's time to have a vaccination plan. So you take the plan, you take the work that's been done, you have to put meat on the bone. And putting the meat on the bone is going to be your communication strategy. It's going to be some of the work the state's going to have to do because to do a pre-registration system, that system would have to interface with their vaccination system to make sure that we're tracking who everybody is. So the state's going to have to do some of that work. Somebody's going to have to be responsible for the vaccines that come into the community to make sure they get where they need to, upstate. And then from there, you figure out the rest of it. That's where you'll see your counties, your health departments, and then your primary care providers as well. So what the state still needs to solidify, what does phase 2 look like? We know what it looks like now, but to start phase 2, do you do your essential employees over 65? Do you do your essential employees over 65 with certain health conditions? I think that's a good idea. Do you move your seniors who don't live in assisted living in a nursing home into phase 2? I think that's a good idea. I think these are the things the state's working on. Each region's got to put together their plan. A lot of this work's already done. Some of it you need to put the meat on the bone for the pandemic in front of us. And the hospital themselves doesn't have the ability to do that. That's where we come in.
Do you foresee primary care physicians taking care of most of their patients and the county filling the gaps? Or do you expect the average person to take advantage of something like the FSHAT or the state fairgrounds to get a vaccine? Or Shopping Town Mall.
Yeah, so I think you'll see, there will be sites, right? And I think that your primary care network, and again, this is me speculating a little bit, but who knows who has the pre-existing conditions better than the doctors, right? Who are most vulnerable, and then who knows the age of this individual who's got these existings, and that's the person you got to make sure gets a vaccine first. So your primary care provider has got to be plugged in through that. So how do you best reach them? Maybe it's the primary care networks helping pre-register these patients at a site. But again, those details will get worked out. But your medical directors, we have a health commissioner, they're going to be key. They do this work. They've done it, not at this scale. So you put the plan together, then we got to put the meat around the plan. That's where our emergency management comes in. That's where all of our resources come in, and you get to work.
With Christmas coming up and, people probably gathering, a lot of people have been going to get tests right before then. We've heard of some people coming up from different parts, different states, and getting tests here. Are you guys regulating that at all, or is anyone can get a test?
Yeah, we've thought about whether you regulate that or not, but if they're in our community, they're a risk, so we'd rather know if they are carrying the virus or not, right? So that's something that's there. Again, we don't encourage traveling. We don't encourage you hosting travelers. I know it's hard. This is like, this ruins my plans too, just like everybody else. Great Thanksgiving plans. I spent Thanksgiving in a quarantine. So this is just what it is this year. And we have data that these holidays are a problem. People were skeptical. The politicians always talk, they're always overreacting. Well, Thanksgiving led to 460 cases in a day here. Now we're on the downward trajectory, right? Our two highest days are today and tomorrow, and they're not going to be 460. They're like 100 less, maybe even less than that. So let's keep it going this way. And then there's the decision to make next week that people are making. And, even if you get tested on next Tuesday, that's probably not good enough going into Friday. Christmas Eve, yeah, if you want to go take the test and you're a negative and you want to go quarantine and then see some loved ones, there's still risk in that. But at least you're doing, you're doing as much risk mitigation as you can. I just encourage people to be with their pods. They've probably been with pods, family, maybe a couple other immediate family outside of your household. Better if it's just your household, but I understand if you have one or two relatives that are always with you. It's tough. But if you do that, that's the safest. That's the safest.
I like your idea about asking employers to perhaps de-densify next week and let people almost begin a quarantine at home right before the holidays. I'm wondering if you could speak more to that idea and if you think that it's just kind of a pipe dream or you think that can actually happen.
Yeah, I think in certain areas of the economy right now, right, retail, you're not going to see any light. People are going to be shopping. People are still going to manufacture things, and people are going to still have logistics. But some of the offices and some of the companies where you had success with remote work in the beginning, the schools are off next week. It's a good. You almost by letting your workforce work from home next week, you almost start that quarantine going into there, and you're avoiding levels of risk, levels of human contact. So I think it could have an impact, whether it's a dozen of cases or not. That has an impact. Right now, the rate of transmission a little over 1. You can stop 20 cases from happening. That's really 40 cases.
Do you know yet like a date of when you or Dr. Gupta will get the vaccine?
I don't. So we would be we would be round 2 essentially. The one variable is with any of these, the Pfizer vaccine. My understanding is that once you open it up, you have those doses. You have so much time to use those doses. So certainly, no hospital is going to let anybody, if they got 10 doses left and they got through everybody they're supposed to, they're going to go vaccinate 10 more people. They're not going to let the doses just go away. But I would be round 2, so that could be in January. I've had 2 people suggest 2 things. One, you shouldn't get a vaccine because somebody else more vulnerable should get one. That's a good argument. And if that's where everybody thought, I would do that. Now, more people want to see me get a vaccine to prove that it's safe and that we're not asking people to be guinea pigs. So more people have pushed me on that direction, so that's the direction I'll go, so that people know I'm promoting it. I believe it's safe. Give me the shot.
Did you say 1,000 people now have been vaccinated?
Yeah, we'll try to put out more accurate numbers, but we had about 650 people going into today. I think that right now that 600 number is probably what you can do in a day with the way things are set up now. But we'll get an exact number on today's, or close to an exact, later on today.
The last I checked in with St. Joseph's and Crouse, their staff hadn't had any vaccinations yet Upstate is holding on to some product for them, according to the governor. Do you know what the network is like to get those vaccination opportunities to other hospitals?
So my understanding, and again, I may be wrong, but I think I'm right, is that literally it's a chain of command issue with the vaccine. Upstate's responsible. So what you have is they're going to go through their personnel that meets the criteria. Then I don't think I think at that point maybe even the personnel from the other hospitals in Syracuse may come there. They may set up chain of command distribution in the other regional hospitals at a later date. But I think right now Upstate has to hold on to the vaccine. Now that may change. That may have changed today. But I know that is the way it's been set up right now.
What has Upstate briefed you on their plans to bring workers from other hospitals in for a shot?
They haven't, but to my understanding, they can't just give the vaccine. I got 2,000 of them. I'm going to give you 300 and you 400. I don't believe they can just do that the way they've been instructed. So they may get to that, but I don't think they're there yet.
I know the nursing homes were almost hoping they'd be among the very first, but now it looks like it might be a week after the very first. Was there a delay than what people expected for the nursing homes? Should they have been this week and not Monday?
Yeah, so I wish they had it as soon as they could. It looks like the 21st is with the network that was set up there, that's really the first day where the distribution has gotten to the pharmacies that have partnered. Again, I think there's 4 or 5 different ones that have partnered with the different facilities. So some will start Monday, some will start Tuesday, some may Thursday. I'm getting a schedule, and so I'll know each day how many. Obviously, this is a race in these buildings to get these people the vaccine because the virus has been preying on these buildings. So we want to see it done as quickly as possible, and we've in our calls have pushed that to the administrations at these facilities that if you're getting your partners saying they're busy, keep pushing. Let's get this done as soon as we can.
And could they be completed by the end of next week?
I don't think they're all going to be completed by the end of next week. I think I know we'll have probably at least a couple thousand completed in nursing homes next week, at least.
Where does the transition facility for hospitalized nursing home residents stand?
We have been having lots of questions come back. We've been answering lots of questions. I believe it is imminent that will be approved. That's very important because that takes your 302 number from Onondaga County under 270. And then overall in the community, we have 378 COVID-related hospitalizations for all the counties, central, some northern, maybe even Mohawk. That would bring that number under close to 280. So there's a lot of folks waiting a discharge right now. So that when you look at hospital capacity, to have a true reflection of where we are, especially if you get too bad, you have economic restrictions, you have to have people that shouldn't be in the hospital not in the hospital. So we have a good solution, and we think we're going to get the approvals very, very soon.
You've often looked to tell a story behind a piece of data. I'm wondering what the story is about 18 deaths that you reported yesterday.
I think it's I wish I understood it more, and I don't have a good sense on what the nursing home number, if it was 24 hours, or many counties across the state reported very high numbers, or if this was everything getting reported at once after a week or so. But it's a reflection regardless on people losing their lives to this pandemic. So what's terrible about this pandemic, when I see this from my experience and I see nursing home cases come in, I know out of those cases not everyone's going to recover. And so it's really a reflection of the cases 10 days ago that happened. And so every day we see new senior facility cases. It's heartbreaking when you see the case, because you know the outcome for some of them is not going to be one where they're going home.
The cluster that you found at a assisted living facility, have you started routinely going into those and testing again, or is that something that just resumed recently?
Yeah, we resumed it this week, Tim. We wanted to proactively go out where the most vulnerable in the community are. Assisted living facilities, if you recall, round one of this in this first wave, we went through, found some asymptomatic cases, not clusters, but asymptomatic ones, which we helped isolate quickly and we believe save lives. This time, this was remarkable. We know that the same facility had a couple employees test positive a couple days ago. So we weren't expecting this, but we are really, really happy that we were there that day and now we're working with treatments with these residents so that connecting their medical team with the hospitals on ways to work together so you prevent 27 hospitalizations, and what kind of treatments can be given to help keep these people in good shape right now.
Was that the first facility they'd gone to?
We did. So we did 200 tests yesterday in these facilities. I believe it was 3 facilities. Give you an idea how I think the positivity rate was 14%, 28 out of 200. This facility was 27 out of the 28 cases, and I think there were 80 tests. So again, it helps us isolate the positives, and it helps us really isolate the folks who are negative too, but start to get them help right away now. And science has really picked up related to this, so hopefully that we'll be able to avoid those hospitalizations. And I think we're out there again today. I don't have it confirmed yet, but I think we might have found a smaller cluster as well in another facility, but I'll get briefed on that later today.
Do you know the general breakdown if it's residents who live there or staff members?
It's 27 residents.
Will you go back to test those residents again in a few days
Yep.
to make sure it doesn't?
We'll go test the same spot next week for everybody else.
And this is the type of community where the residents aren't stuck in a room, for lack of
Correct.
a better term. They're living lives. They just live in a community.
Correct. More interactive. Yeah.
First, kind of significant snowfall. How'd crews do? How do you think they did?
What was
Do you
that?
think the crews out on the roads, how do you think they did?
The
Clearing
snow?
Yeah.
So we're very lucky we didn't get hit like other parts of the state today. I think I heard the southern tier over 3 feet of snow. I know Capitol, Hudson got hit hard. I'm glad it didn't hit us that hard. We got the rust out, so we got great teams. You know, I think we had 6-8 inches in part of our southern towns in the county. So that's always a work in progress when you get these. You get the new plows out. I know the city's got some new plows, some interesting names there, and we got ours out, and we'll be better in 2-3 weeks of snow than we are on opening day. That's how it usually works.
Were you involved at all with any of the schools that decided they wanted to close next week ahead of the holidays?
No, not really. I think what you have is some of these, when you have, when they are referencing an uptick in cases today, I don't think they're talking about cases in the schools. And quite frankly, there hasn't been an uptick in cases this week. It's gone down. But what they're referencing is that quarantines are being disruptive. And there's been an elevated risk in the community. So we don't have a problem with them going remote the last week, going into Christmas. It's a level of risk that you're taking off the table. As you know, we work very hard to keep kids in school. I went to school. Do you remember when you went to school the week before Christmas? Never really the most productive week anyways. So a lot of excited kids. So this de-densifying everything going into this, is not the worst case scenario.
Don't tell Mrs. Donovan her classroom isn't productive before
Oh,
Christmas.
geez, I don't want to get anybody mad, or Mrs. McMahon, but I remember as a kid, and I got 3 of them now. I think they're focused in on the elf. And by the way, everybody who was worried about the elf on the shelf being in quarantine, I gave an executive order to Dr. Gupta. The elf on the shelf is out of quarantine, so we're good there, kids. But you know, we're getting ready for a big day here for the kids. And I know the kids have been great this year, so Santa's going to come. So this is all good stuff.
What's your briefing schedule next week?
I think we're going to do interesting. Good question. You guys want to work on Christmas? Should I bring you all here on Friday? But no, we'll do Monday, maybe Monday and Wednesday, maybe. We'll do that.
The governor threatened a Thanksgiving briefing.
Yeah. I can't do that to you guys. So we'll do Monday and Wednesday, and then obviously if something happens, Christmas Eve we'll be very busy testing, but if something else happens, we'll.
Brian, I know there's a separation, but do you know if the state is still testing nursing home residents aggressively?
I don't know the specifics, Tim. I know that the state is monitoring the quality controls within, whether it's infection control, and again, the elevated cases in nursing homes in our community, we're not the only ones. It's across the state now. It's just it's the way this virus performs. So we've offered testing capacity to have people go help do this if they need help. We've offered that. Other questions?
You were right on time today, by the way.
3:06. We try it every day.